So thank you all for joining this evening. I'm super excited to have our class of 1972 grads, in addition to a few other stakeholders and friends with us this evening. For those of you that haven't met me yet, my name is Jordan Langer, and I serve as the Alumni Relations Officer for the School of Nursing. It's been an honor to work with this group over the past 8 to 9 months for some of us to bring this reunion to life. So again, thank you to everyone who's been working really hard to reach out to all of your classmates and get this, brought to life. So before we start and really get into the meat of our event this evening, I just want to again do a brief land acknowledgement and call attention to the fact that the UW-Madison campus on the School of Nursing sits on native Ho-Chunk land. We've tried to incorporate that into all of our events and reflect on the space that we actually occupy. So thank you for that. I do want to introduce Nicole Bartles. She is one of our current nursing students and a student ambassador. So she is here in case my Zoom goes down or anything like that. But she's here with us this evening as well. Nicole, do you want to just do a quick intro and just a little bit about yourself to the group? Again, you're a current nursing student, so I know our guests love to hear from you.
Yeah, so I'm Nicole. I am a first-year traditional BSN student. I have been born and raised in Madison, so I'm really familiar with Madison, and I've really been enjoying this first couple weeks or month of getting to be immersed with the nursing community, which I haven't really had a lot of information from because of COVID and stuff. We've been all virtual, so I've been really enjoying this past month, and I've really been enjoying this past week. I met some of you actually in person in my clinical group, and also met some of you guys on Sunday. So I've really been enjoying this week too.
Wonderful. Thanks so much, Nicole. So again, she'll be here monitoring the chat in case you have any questions or need anything throughout the evening as well. So now I'd actually like to introduce you all to Dr. Veronica Engel, or Ronnie, as we've been calling her through our committee work. Ronnie is a class of 1972 graduate. She will be introducing our presenters this evening. Dr. Engel is an Emeritus Professor from the University of Tennessee Health Science Center in Memphis, Tennessee. She served as a professor for 27 years before earning her Emeritus status. As an educator, she has helped develop and teach within the first PhD program, nursing program in Tennessee. She was an NIH-funded scientist studying health disparities, pain, and end-of-life care of older Black and white adults. In addition to those roles, she was a clinician practicing as a geriatric nurse practitioner in an inner city Medicaid clinic and developing Tai Chi wellness programs for older adults. I couldn't think of a more appropriate 1972 grad to introduce our speakers this evening. So Ronnie, I will turn it over to you.
Okay, thank you for the opportunity to introduce our speakers and talk about the Care Center. I'm going to depart from the script, of course. I was so glad to see you mention the acknowledgement of the Ho-Chunk Nation, because for those of us in 72, we were all there for the anti-Vietnam War riots on campus. And if you go by the bell tower in Commerce at the top of the hill, there's a little stone marker that says Chief Black Hawk was pursued by Army regulars, and I think it was in 1832, through these hills. And in 72 and 70 with riots, the students were being pursued by Army regulars, now called the National Guard. And it was very ironic. And now we've come full circle in acknowledging the Ho-Chunk Nation. So I was really pleased to see that. The Care Center is such a fabulous entity on campus and really continues the pioneering efforts in gerontological nursing that the School of Nursing always had. And it really embodies the Wisconsin idea because it brings the benefits of scholarship and research, et cetera, into the real world. And so we see that with the partnering of the Care Center with providers and consumers in the area. And even more importantly, it really addresses the women's issues of aging whether we are the paid or unpaid care providers, or we are the care recipients. And so the work that the two Barbaras are doing at the care center and the care center is really critical as we move forward. And we're very fortunate to have Dr. Barb Bowers with us today, founding director of care. And her work really came from her clinical practice in looking at staffing and retention and quality of life issues with workers in long-term care, and looking at how you impact on systems of delivery of care. So she was really a precursor to what we are wanting our practice doctorate students to do with scholarship from practice and looking at organizational issues. And then she then transitioned into the home with the formal and informal caregivers, critical gaps in our knowledge. She also is an expert in qualitative research methods and serves on the editorial board of seminal nursing and other professional journals in being that voice for qualitative research. I've always been a quantitative research my entire life, but I collaborated with one of my collaborators was a qualitative researcher. So I understand that interface and the challenges of communicating your qualitative research and methods and outcomes to the quantitative reviewers and the quantitative reviewers and vice versa. And I'm bringing this up because for the only time in my life, we published on end-of-life needs of terminally ill nursing home residents, which was a qualitative study. And it was going to JAGS, which is quantitative. And so we knew we had to sort of soften the qualitative methods to appeal to the quantitative researchers, but have enough meat in it for the qualitative folks. And we were rejected by both the quantitative and the qualitative reviewer appropriately. But the editor decided it was such important work that it was published. And not many people can say that they've had a publication rejected by both reviewers and it's published. And it's since considered one of the seminal works in end-of-life care in nursing homes in the hospice literature, because nobody does that. And I'm pointing that out also to the student that you just have to go out there and follow your passion. And we've really seen that with the two Barbaras. Shifting to Dr. Barb King, she holds an endowed chair. Yes, you know, chapeau to you for that, and is now the director. She's also a Madison product, though, with her master's in nursing and PhD. So it's nice to see that continuity. And also working with the two Barbaras, what a wonderful collaboration. And she really is that pioneer looking at, we need to treat older adults in hospitals differently and address the critical problem of deconditioning. We don't just leave people in the bed anymore. And so that's really critical in helping people transition out to the community. And again, that's that integration across systems of care, working with formal and informal care providers and working with the recipients of care. So we, in both of you and in the care center, we have such a wonderful exemplar of the Wisconsin idea. And I'm really excited to hear about what you're going to tell us today.
Thank you, Ronnie. Okay, so I think we'll go ahead and put up the PowerPoint. Great. Okay, wonderful. We had a little bit of a technical glitch, so we need to have Jordan or Nicole advance the slides. So I'm going to start with talking a little bit about the history, where CARE came from, where the idea came from, and how it developed very briefly, really get into more about what has CARE been doing, what are the things that we've created, produced, disseminated, and then Barb's going to talk more about what's happening at the moment and into the future. So next slide. So what is CARE? It's the Center for Aging Research and Education. We actually had a contest for the, the name, and this one won. We like it. So CARE formally was established in 2011 with the efforts of a lot of people and the support of the dean at the time, which was great. We got a beautiful space that we still have today, which is actually really important to have a gathering space for a program or an initiative. But this was not the beginning of the vision. In 2001, the School of Nursing got a grant from the Robert Wood Johnson Foundation, which was a joint grant to the Department of Health in Wisconsin and the School of Nursing to collaborate on the development of educational programs for workers in the Wisconsin, in government-supported Wisconsin services and programs. So what we were asked to do was to develop educational programs in mental health and substance use, which we did, and those programs have been used all over Wisconsin. It was great that they came to us, and I have to say that I have done this as well as Barb and Tanya Roberts, other people affiliated with CARE, made a real effort to reach out to policy people in the state. There's a lot of important programming going on there. We can have an input into direction of programs, but also I can't think of a better way to disseminate things that you have or that you produce is by getting into a government program. So we've been working closely over the years with the Department of Health, in particular with the Division of Quality Compliance, although it may not be that now, they keep changing their name, and the Bureau on Aging, which is now Aging Disability Services. But it really brought home the importance of bringing together researchers, practitioners, and state partners in order to make these programs work across the state. And as Ronnie said, a real example of the Wisconsin idea. The other thing that people in the state realized very quickly was that we had expertise in pedagogy, that it wasn't just, as a lot of their programs had been, just giving information to people, that we actually knew how to craft things in a way that people were engaged in the learning process. So this has been, I think, one of the most important parts of CARE going forward. And I'll talk a little bit about more initiatives we've been involved in, but continue to link the School of Nursing, the clinical expertise, the research expertise with state programs. Okay, next slide. So in the early years of the center, we focused on developing the nursing workforce, and really it was mostly inside the School of Nursing. So I don't know how many of you are familiar with this, but there have been some issues, a fair number of papers written, studies done, looking at where's geriatric content in undergraduate programs in schools of nursing. And there was a national mapping exercise that we got involved in. But we took a good look. Actually, Barb King led this effort in the school. Took a look at where is the geriatric content in the school? Is it leveled? Is it appropriate? Are students learning the basics about care of older adults? We used to have a course on care of older adults and aging, but like most schools of nursing, we no longer have that. And most schools now have gone to something called a concept-based curriculum, which I don't know if people are familiar with, but the idea is you can't teach everybody all the information they need. So you have to teach them concepts, and then they can take those concepts and apply them to different populations. That's nice in principle, but there are still basic things about care of older adults, as probably are with other populations, that really need to be included in the curriculum. And there's also research, there was then, and there still is, that looks at the fact that our new grads are not really prepared to take care of older adults. The issues are too complex, and they often don't understand how to modify things for people of advanced age. So what we did was we went on a real effort to find supplements for the undergraduate students. So we found articles, we developed case studies, and the concept-based curriculum text had almost no aging. So that really motivated us all to do that. We also have a list of guests who have expertise in different areas of aging and care of older adults. So we've created a repository for all of those things. So now the undergraduate faculty can just go into the repository and find things that they need. We just to coax a little bit to get them to do that, but it's actually worked out really well. So most of our faculty with expertise in aging are now doing guest lectures in a lot of different classes. We also supported the undergraduate aging interest group. It originally, I think, was started in the School of Medicine. It fizzled out completely, and then it was picked up by two of our undergraduate students, one of whom is now a faculty member, my two Laura, in the School of Nursing, who ran that organization, and Andrea Gilmore for several years. CARE started a careers in aging fair where people from the community who are serving older adults can come in and talk about what they're doing, about job opportunities in that area. So that's been an interesting way for our students to see that care of older adults there's a wide variety of opportunities, which they mostly were not aware of. We developed a course in dementia, which has been campus-wide. Very popular course, always fills quickly. Student service learning connections, which are connections of students in undergraduate classes to older people in the community. In the assessment class, where they talk to an older person, actually learn that you can hit 40 years old and still be functioning. I remember the first time I saw a student write old as 40. So they actually learn you can be 90 and still be doing really well cognitively, physically. So those are really important experiences for our students. And then we have an annual aging scholarship. Okay, whoops, advance the slide. I'm trying to advance it here. Obviously, it's not working. Okay. Just quickly, we've also sponsored a number of programs that involve the community, other schools of nursing, practitioners in the community. We had a Music in Memory, which is the program that's been developed and is now nationwide about recording music that was particularly important to people, on giving them earphones so that they can listen, people with dementia who can listen to the music that was important to them in their life. We had Teepa Snow, we had a huge, several hundred people come to that, who is an occupational therapist who trains caregivers how to work with people with dementia. We had Marty Schreiber, who is a former governor, come and talk about his book, My Two Elaines, which is a story about caring for his wife who had dementia. And then a number of researchers who are doing things in aging, who we have still almost monthly people presenting. Okay, next slide. So I'm going to very quickly go through, and I'm just going to pick out a couple of things here, but we have a lot of products. You can go on the CARE website and see most of them. One of the things that I think I'll just talk about a couple of these here, but Manual for Caregivers, this is based on a 3-year research project with colleagues in Australia, looking at the challenges of caregivers who are caring for people aging with the whole range of issues. One of the things that we have in there is, first of all, it goes through a very lay language, what happens when people, what's normal aging, what's not normal aging, what are some of the things that you can do, whether it's vision or hearing, to actually make life better for people who are having age-related problems. And there are worksheets there. I'm just going to give you an example. There are about 25 or 30 conditions or situations that we include in there, which are things that get older people into trouble that caregivers don't generally have enough information about. So for example, there's a worksheet there that says if somebody falls, here's all the information that's going to be important to the care provider to make the right diagnosis. So it's a list of things, what happened right before they fell, did they lose consciousness, it's like taking a history, but it allows the person, the caregiver, to bring in the information that's going to allow the care provider to make the right diagnosis. I'm going to let Barb talk about CareU later, and I think I just briefly, probably should not take much more time here. GeriRes, which is a program that, for those of you who aren't familiar with it, most hospitals now have nurse residency programs. They accept the fact that when a nurse graduates as an undergraduate, they're not really ready for practice. They have a lot of learning to do, developing self-confidence. It's kind of scary, actually. So most of our nursing students, when they leave, they want to be in a residency program. They don't want to go someplace where they just get thrown in as another nurse on the unit and they sort of have to sink or swim. So residency programs for hospitals are a year long. We have been trying for years, to get residency programs up and running in nursing homes. There's a whole host of challenges, which I won't go into, but we decided that we would create residency programs that are specifically designed, tailored for long-term care settings, and that is nursing homes, assisted living, and home care settings. And so we developed them, and they're in operation now, at least the first two, the nursing home and the assisted living. There are a lot of organizations that are using them. So people are earning certificates as a completion residency program in long-term care. And I think one of the most exciting things we've done recently is we have a graduate she was a graduate of our PhD program, who's a director of nursing in East Jerusalem in a Palestinian hospital. They had no access to education for their nurses. They have a 26-bed geriatric unit, which is the only unit in East Jerusalem. And so we sent them geri-res, and they've been going through it with through the whole 16 modules, and have been meeting with our DNP faculty talking about the modules. And there's one tomorrow, I believe, where one of our DNP faculty is going to be meeting with this group on geropharmacology. So that's exciting. And we have a number of other projects. I already mentioned the dementia course. We have a toolkit for developing a foundation for care of older adults in rural communities. And the rest you can see them on our website. So we don't have time to go through them all. Go ahead. Just about done. Next slide. Okay. I just want to say that we have not had the ability, the School of Nursing is not set up to disseminate and market. So what we have done is we have partnered with other organizations that can do this. And just one of the things I wanted to tell you about is we had a DNP student who developed identified pressure ulcers in dark skin, because people with dark skin actually end up much higher mortality, morbidity rate, because pressure injuries are missed, because the way we're taught to identify them doesn't work with dark skin. So that's been turned into a beautiful video. It's up on a website, freely available to everyone. Okay. Yeah, go ahead. Next slide. And I think I will skip this. This is just a list of the policy things that we have done over the years and continue to do, from presentations to congressional staff and congressional representatives, to presentations for state organizations, and CMS policy quality improvement programs. And so Barb, take it away.
Okay, next slide, Jordan. Thank you. So CARE has 3 pillars that is our structure. We focus on research, education, and outreach. And we've been working on this development of these 3 pillars and thinking about which needs to come at the forefront to do some more work in areas that we've done quite a bit in. So I'm going to break this down and talk about our present activities in the 3 pillars. So next slide, Jordan. So I'll talk a lot about research. I would say probably about 3 years ago, we stood back and focused, like, what are we doing in research? How can we support our researchers? Will the center actually be conducting research? And try to get more of a focus and a mission related to research. So we took the angle of what we can do in the center is support researchers in conducting aging research. So we've done quite a few things in this area. We've built strong relationships with different community sites across Wisconsin, particularly in long-term care and assisted living, where it can be a little bit more challenging for researchers to access those sites and get those sites to participate in research. So we've focused a lot of our efforts on how do we build these relationships. And you can imagine the turnover rate of administrators in nursing homes. So it's a continual process of continually thinking about, sustaining and building those different types of relationships, so that we have, when a researcher says, I need to access long-term care, we have a resource for them to be able to say, here are 4 different nursing homes that are interested in participating as a research site. We've also worked at creating templates for IRBs and grant proposals. on what is aging, the impact of aging, how can you recruit persons living with dementia, standard language that can be used and can be adapted for any of their proposals or for their IRBs. So that's been really beneficial for our researchers. Also in supporting our researchers, we want to support our future researchers. So we have different scholarships available that support the research of our PhD students, the scholarly work of our DNP students, and also the research work that our undergraduate honor students are participating in. We also use some of these funds to support ongoing faculty development in aging research so that they are positioned well to continue their work. But in terms of care, we've also looked at, well, how do we attract research dollars to the center? And we recently were awarded a patient-centered outcomes research initiative implementation grant from PCORI. And this was to build 2 Board of Older Adults advisors. And so we have one in the Madison area that's predominantly persons of color. And then we have another one in rural Wisconsin, predominantly veterans and males. And what these boards are set up to do is to meet with researchers to work collaboratively with them on the research design. What is going to work for older adults? What are the important research questions that older adults want to have, and what are the important outcomes that older adults identify with? I will tell you that we opened this up. We have 4 spots for our urban, 4 spots in our rural over this 2-year grant period. They filled rapidly, and we have a waiting list of people that want to have access to these, what we call them the BOAs. So we're really excited about that work. We also have a recent project that's funded through the Bader Foundation and in collaboration with the School of Nursing and UW Health. And this is to help them think about expanding their age-friendly hospital initiative. So this is a 2-year project that we recently just started. If you know anything about age-friendly healthcare, this is a Johnny Hartford Foundation and IHI Foundation really came together and said, we got to do a better job in creating our health systems that are age-friendly. And we have better outcomes for older persons that are accessing our systems of care. We've also worked really hard at expanding our care affiliates so that we can promote more interdisciplinary research. Right now we have 37 affiliates. Those also include graduate students, and those affiliates represent 11 departments. So we have nursing, the School of Medicine, social work, sociology, kinesiology, the Center for Interprofessional Education, UW Extension, the School of Human Ecology, Communication Science and Disorders, and engineering. So it's wonderful to be able to bring together these multiple disciplines to talk about how do we do aging research and really to help them build collaborations to work with each other. Next slide, Jordan. And then I want to talk to you about our education pillar, and Barb talked about some of the shifts we've had to make when we went from when we did a curriculum change, when we had a standalone gerontological nursing course to a concept-based curriculum. We were trying to integrate aging content within that curriculum. We did a gap analysis, and we found that geriatric content was really missing quite a bit in our curriculum. So what we've been able to do with the new AACN Essentials is to now reinvigorate how do we get more gero content into our undergraduate curriculum so that we really have students that are more practice ready. But we've done a lot with simulation. So we had another Bader Foundation grant where we built 4 different geriatric case studies and simulations. We did that jointly with our clinical faculty. Those are available on our CARE website and also through Health Innovation Programs. And they have been picked up across Wisconsin and the United States. It's really exciting to see who is accessing our simulation toolkit and using it in their own programs. Along with simulation, we have been able to purchase a lot of simulation equipment. So this picture shows we mess with people's hearing, we mess with people's visions, and we mess with people's tactile sensation. really we do that in a lot of different ways to talk about what are some of the challenges that somebody might have if they're vision impaired, hearing impaired, or might have severe arthritis or living with dementia, in terms of communicating with individuals, having them do functional tasks, and then navigating our healthcare system. So you will see our undergrads wandering around the halls and our DMP students in full simulation gear, and being able to understand more what is those lived experiences of older adults that might have some of these impairments. We've also looked for ways to integrate geriatric content into our older adult program by using our older adult telehealth project. We had an older adult project that was integrated into our gerontological nursing course when I taught that, but when the pandemic hit, I got a rapid call from, can you help us? Can we figure out how to activate the older adult project, but do it telehealth so that our students have a clinical experience? And I said, oh yeah, we'll figure out how to do this. So CARE arranged and found 165 older adult volunteers that meet with our students, and we're engaged in health history and using standardized tools for health screening. This is such a huge hit. We are continuing it, even though we have our students back in person with patients, both in the community and in healthcare systems. So really a wonderful project to continue. And if any of you are part of that, thank you, thank you, thank you. It's such a wonderful experience all along. In fact, I will tell you that I was up on the inpatient unit recruiting patients for one of my studies today. And one of my former students said to me, Barb, do you still do that older adult project? I'm like, yeah, it's now, we do it virtual. And he goes, that was the best experience of my entire nursing school program. And he said, my older adult was 80-year-olds and is still doing aerobics. And I go, and I bet you couldn't find that person either because they're so busy. He goes, yeah, it was eye-opening for these undergraduate students to have these relationships and interactions with older adults across our communities. We've also integrated our aging content into the new public health residency program that Susan Zahner heads. And I will tell you that we also did a hearty effort to put a grant in for the American Nurses Foundation Reimagining Nursing Initiative grant. We got actually a pretty good score, but we didn't get funded. In fact, they've passed on our proposal to other potential funders. What we wanted to do is more actively place our students and build a long-term care as strong clinical sites. So we're not giving up on that. We're trying to figure out how to continue to move that vision forward. And then we have new personnel. So we have Dana Decker, who's come on board to help us with a lot of our educational initiatives, which really helps support Diane Farcetta extensively. I have a great quote here from a former undergraduate student. So next slide, Jordan. And then we have outreach. So Barb referred to CareU. So when Barb first started the CNA PCW programs, she came to all of us and said, hey, how would you like to travel across Wisconsin and give these free all-day workshops? And we all said, okay, yeah, sure. Where do you want us to go, Barb? We will go wherever you want us to go. So she had experts across disciplines go and lecture, provide a free all-day workshop to certified nursing assistants and personal care workers that are predominantly working in home care, assisted living, and long-term care. Overwhelming response. People, our direct care workers are hungry for any additional knowledge and training in care of older adults.
There was capacity for every one of them,
Every
like
single
60,
one.
70
We were
people.
all over the place.
Yeah.
And we realized that we can't sustain this. This is fun,
Yeah.
but we can't sustain this. So then we created CareU, which is a train the trainer format. So we asked for people to come in and we will train them in how to do these workshops and give them all of the resources and materials, and they go out and launch. And we were all set to launch this face-to-face, and the pandemic hit. So we did a rapid shift and we did it all virtual. It was a highly successful. We've heard from a lot of our trainees that have been able to implement a lot of our CareU programs across Wisconsin. So we're going to push this.
Yeah,
I
I
still
just
one of the
wanted to
ones.
say that we ran into so many people who said, I've been a CNA for 12, 15 years, and I've never been to an educational program before. These are people who are in the front line and they have almost no opportunity for any kind of education. So they were really hungry.
They loved it. So our CareU idea is to look for a HRSA grant where we can expand this across Wisconsin and other states so that we can do more train the trainer programs and people can take this program out in their area. We have dementia-friendly toolkits. Bader and Baldwin Foundation supported our dementia-friendly community. The Renenbaum Foundation is supporting our dementia-friendly hospital. Again, where people are clamoring to get these toolkits so that these toolkits are set up to train and prepare anyone within these organizations and hospitals for how to communicate and directly work with persons living with dementia. Barb had the heart program. I don't think we have a whole lot of time to go through that.
That was really just working in rural communities that are so hard hit and have so few resources. And it's helping the rural communities figure out how to take the resources they have, how to work together. I was sort of amazed at the silos that actually exist in rural communities. They didn't know about each other. So a lot of what our work was looking at how to implement a program that brings people together, creates new opportunities. We had all kinds of things that were pretty low-hanging fruit, but just hadn't been done. And we've created a toolkit for other rural communities.
So I said when I came on board as the director in care, we can never replace Barb Bowers, but I came on board in 2018 and said, you know, I don't think people know enough about what CARE does. So we need an annual report that we can get out there. So we started the annual reports in 2018, hugely popular, really highlighting a lot of the accomplishments of the center. We really boosted up our social media presence. So we are on Facebook and Twitter. I will tell you that we have 884 followers on Twitter. I just have to read you some of the list of our followers. The one that I love the most are the Grey Panthers of New York City. Voice Local, which is a UK Board of Older Adults Advisory. University of Minnesota School of Nursing, Leading Age, Wisconsin DON Council. Reframing Aging, which is an AARP in Hartford program. Paula Spann, who's a New York Times journalist, follows us. The Duluth Age Friendly, excuse me, NIA Small Business Programs, NIA Behavioral and Social Research, the American Society of Aging, the Journal of the American Geriatric Society, the American Journal of Nursing, Next Avenue, which is a PBS news source for older adults. So lots of national and international followers on our CARE Twitter feeds that go out. So if you want to know how to find us, go to our CARE website. You see the Twitter address. It's great information. We have our advisory committee that Barb started. It's 12 members. 4 of those are students. We have 2 undergrads, 2 PhD students that work with the advisory board on really what should be our mission and next goals for CARE. And next. And then just to tell you about our support, as you can see, a large amount of our revenue is coming from grants that we get to support the center. The School of Nursing also provides support. So they provide 15% of my effort in faculty, and then 55% of Diane Farsetta's effort as our manager for CARE. We've been able to bring on, because of donor support, another part-time position, which is Dana Decker. Our product sales, even though they are amazing, it's only 0.2%. It's really hard with the university to distribute products and get revenue in. It's been a major barrier for us. And then our donor support, which sits at 11.6%. Our donors have been, we use a lot of those funds to support student scholarships, students training. We help faculty development, and any other initiatives where we need a smaller pot of money that we can feed into with a larger pot of money. And next slide. So where are we going in the future? Well, here, we have big ideas. I am constantly looking for a center grant. Somebody's got to want to give me several $1 million to really bring in external funding for the Center for Aging Research and Education. So we are continually looking to see what's out there, what's available, what can we be applying for. I think we are incredibly well positioned to be applying for a center grant. And then I think our other issue is like, how do we continue, and we talk about this all the time, about expanding our 3 pillars. How do we continue to push the boundaries of research and support our researchers in aging science? How do we continue to expand our educational mission, reaching more of our undergraduate and graduate faculty? And then I think our big push is, how do we continue to do the impressive outreach work that we have done in the center?
It's very labor intensive.
That really pushes the Wisconsin idea and really supports our community at large. So with that, Jordan, next slide. We thank you for your attention. I know we ran through things pretty fast. Jordan, I'm going to turn this back over to you.